Hyperbaric oxygen chamber treatment is a high-pressure room where the concentration of oxygen that you are breathing is higher. And by being physically in a concentrated oxygen chamber at a higher atmospheric pressure, high pressure means that more of that oxygen saturates your blood. But the thing is, before we ask ourselves whether we should use a hyperbaric chamber, the question is, what is the problem you're treating? Because if it's a blood flow problem, then I'd like to make sure we're optimizing the blood flow to that area with the good technique. And then, of course, if the patient has blood flow issues, another tool is a vacuum dressing you can place on the incisions. Dilates the capillaries and helps accelerate the healing by improving blood flow locally to the area. We can put those on at the end of surgery to improve blood flow. But if there's a problem with blood flow that we notice early post-op, sometimes we'll send a patient for hyperbaric treatment. What that'll do is increase the oxygen that your blood is delivering. So in the hospital setting, they have high pressure tanks that'll put several atmospheres of pressure. That delivers a lot of oxygen by your blood to your tissues. Outpatient hyperbaric chambers aren't as powerful, partially because they can be dangerous if you use high pressure chambers. The outpatient centers for hyperbaric typically are delivering oxygen at only about 1.2 to 1.4 atmospheres. That's not delivering a lot of oxygen. So I'm skeptical as to the value of that for many situations. If we're really worried about blood flow, I'd rather send you to the hospital where you get a higher pressure treatment, very concentrated oxygen in a safe environment where they can do high pressure chamber. But ultimately, at the end of surgery, if we see a little problem with blood flow, also, I'll place a suction dressing called a wound vac over the incision to directly treat the area and improve the blood flow in those areas, because most healthy people have plenty of oxygen in their blood. So if there's a problem, it might be that there's not enough blood getting to the area, not that there's not enough oxygen in your blood. Does that make sense? That's why I don't always recommend hyperbaric after plastic surgery. It seems like a waste of time.